Welcome to this video where we explore Balkan endemic nephropathy, or BN, a chronic kidney disease with a mysterious origin, primarily affecting populations in specific regions of the Balkans. Join us as we delve into the causes, effects, and management of this debilitating condition. The exact cause of Balkan endemic nephropathy remains elusive, but the leading suspect is aristolochic acid, a toxin found in the Aristolochia clematitis plant. This plant, a common weed in the affected regions, can contaminate wheat crops used for making bread and other staple foods. Over years of exposure, even small amounts of aristolochic acid can lead to significant kidney damage. Other factors such as environmental toxins, genetic predisposition, and even viruses have been investigated, but aristolochic acid contamination continues to be the most compelling theory. The pathophysiology of Balkan endemic nephropathy involves a slow and insidious damage to the kidneys. Aristolochic acid causes damage to the tubular cells, which are responsible for reabsorbing essential substances and filtering waste products. This leads to progressive tubulointerstitial fibrosis, a scarring of the kidney tissue. The glomeruli, the kidney's filtering units, are initially spared, but eventually they too become damaged, leading to a decline in kidney function over time. The chronic inflammation and cellular damage contribute to the development of renal failure. Balkan endemic nephropathy is geographically restricted to rural areas along the Danube River and its tributaries in several Balkan countries, including Bosnia and Herzegovina, Bulgaria, Croatia, Romania, and Serbia. The disease primarily affects individuals who have lived in these endemic zones for at least 20 years, with the highest incidence occurring between the ages of 30 and 60. Historically, entire villages have been affected, leading to a significant public health concern in these regions. The early stages of Balkan endemic nephropathy are often asymptomatic, making early detection challenging. As the disease progresses, symptoms may include fatigue, loss of appetite, nausea, and weight loss. Anemia is also a common finding, due to reduced erythropoietin production by the damaged kidneys. As kidney function declines further, patients may experience edema or swelling in the legs and ankles, as well as high blood pressure. Ultimately, the disease leads to end-stage renal disease, requiring dialysis or kidney transplantation. Diagnosis of Balkan endemic nephropathy can be challenging due to its gradual onset and non-specific symptoms. A thorough medical history, including residency in an endemic area, is crucial. Urine analysis may reveal proteinuria or protein in the urine, and microscopic examination can show characteristic tubular damage. Blood tests will indicate declining kidney function, with elevated creatinine and blood urea nitrogen levels. Kidney biopsy, although invasive, can provide definitive confirmation of the disease, showing the characteristic tubular interstitial fibrosis and the presence of aristolochic acid, DNA adducts. While BN doesn't have distinct classified subtypes, its progression is often described in stages based on the severity of kidney function impairment, similar to other forms of chronic kidney disease. These stages range from mild kidney damage with normal or increased GFR, a glomerular filtration rate, to end-stage renal disease requiring dialysis or transplantation. Currently, there is no cure for Balkan endemic nephropathy. Treatment focuses on slowing the progression of the disease and managing its complications. This includes controlling blood with medications, managing anemia with erythropoietin-stimulating agents, and restricting protein intake to reduce the workload on the kidneys. Once end-stage renal disease develops, dialysis or kidney transplantation are the only options for survival. Supportive care, including dietary modifications and vitamin supplementation, is also important. Prevention is the most effective strategy for combating Balkan endemic nephropathy. This involves identifying and eliminating the source of aristolochic acid contamination. Strict monitoring of wheat crops and implementation of effective weed control measures are crucial. Public education campaigns aimed at informing residents about the risks of aristolochic acid exposure and promoting the consumption of safe food sources are also essential. Early detection through regular screening of individuals in endemic areas can help identify and manage the disease in its early stages. The prognosis for Balkan endemic nephropathy is generally poor, with most patients eventually progressing to end-stage renal disease. However, early diagnosis and treatment can slow the progression of the disease and improve quality of life. Recent research has focused on developing biomarkers for early detection of aristolochic acid exposure and exploring potential therapeutic interventions to mitigate the effects of aristolochic acid on the kidneys. Ongoing research aims to unravel the complex mechanisms underlying the disease and identify new strategies for prevention and treatment. The development of effective prevention strategies remains the most promising approach to eradicating this devastating disease.